we should go ahead and get started. Good morning, everybody. I'm Matt Calabria. I'm honored to serve on the Wake County Board of Commissioners. I'm joined by two of my colleagues today, Commissioner Cheryl Stallings, who's right here, and Commissioner Don Mile, who's right there. I was just texting with Commissioner Tara Waters, former school board member who represents this district and really wanted to be here. She had a prior obligation, but she's been just a dogged advocate for this area and for our children on the school board and on the county commission. And so just wanted to send her regards as well. This school year, we launched two programs, partnerships between Wake County and the Wake County Public Schools. And both programs are designed to support students and families better than we ever have before. These programs represent a huge leap forward in our ability to provide services to families, and they exemplify our commitment to collaboration, to partnership, and also to serving our students. The programs both identify students who are having academic or behavioral struggles and connect them, as well as their parents or their caregivers, with resources that help the whole family succeed. We are more and more aware as time goes by of the mental health, substance abuse, and other challenges that students face. No problem. Thank you. We know that students don't just check their struggles at the door when the school bell rings, and we also know that our teachers, including our school social workers, counselors, psychologists, and all of our educators and school staff are doing amazing work despite scarce resources and extremely heavy demands on their time, high caseloads, and often difficult headwinds that they face as educators. These two programs that we're going to discuss today are designed to better serve our students by integrating what Wake County does with what our schools do. There are lots of national models. We were just talking earlier with Christina Spears, who's here as the president of the Wake NCAE, about the community schools model that the NEA has. But making sure that we break down the silos between the Wake County government and Wake County public school system has been critical in getting these programs up and running. The Neighborhood Networks program is the first program that we're going to talk about today. It was launched in September, and it's designed to embed social workers into our schools to supplement, not replace, but supplement the good work being done by our Wake County public school system professionals. The social workers offer one-on-one support to our students. Very often, educators will identify concerns related to absences, low grades, behavioral issues, or possibly students who demonstrate that they're housing insecure. And so the social worker can reach out to families, reach out to students, and connect families with resources that could help them succeed. That could include job training, employment applications, behavioral health supports, childcare, applying for Medicaid benefits or SNAP benefits, resources that already exist but often aren't understood or known to people who could really benefit from them. Connecting people with these kinds of services is one of the bread and butter areas for Wake County government. It is a core function of what local governments do in Wake County, in the state, and in the country. And so it makes all the sense in the world for us, where we have a comparative advantage there, to integrate with the public schools where all the students are. It's one of the few places where we know all children go virtually every day. And so connecting those two has made all the sense in the world, and I think is already inuring benefits to our students and our families. The second program that you're going to hear about is the Student Engagement Team, or SET program. That program utilizes youth and family engagement coaches who help students and their families set goals and address the social determinants of their health and their welfare. So again, a school will identify a child who may be experiencing significant social or emotional needs, who might be acting out or having discipline issues. And so that student is then connected with a coach who can help the child and also the child's parents or the child's caregivers. They can refer, the coaches, that is, can refer students to mental health services, help that student talk through difficulties that they're having at school and develop strategies for success in school as well as in life. These coaches even do home visits in a lot of cases. And so we're breaking down these barriers and these artificial separations between home life and between school life, because we know that our kids bring the problems they experience at home into school, and they bring the problems that or challenges that they experience at school back home. And so these programs are designed to put the whole child back together and to have a comprehensive, robust approach in helping students address their needs. The two programs are already helping students at 9 schools across Wake County, including right here at Southeast Raleigh Elementary School, which was built and designed as a collaborative partnership with Wake County, the Wake County Public School System, and so many of our nonprofit and private sector partners. And so we're very, very excited to take this next step. So today's speakers are going to talk a little bit about each of these two programs. First, you'll hear from our Wake County Health and Human Services Director, Nanette Bowler, who's going to talk about the Neighborhood Networks program. Then you're going to hear from Juanita Velasquez, who's the assistant principal at North Garner Middle School, which is one of the schools participating in the SET program. Then we're going to hear from a school board member, Toshiba Rice, who's going to talk about the Wake County Public Schools perspective. And then I'll wrap up, share a few thoughts, and then we'll open it up to questions for everybody. So without further ado, we'll turn it over to Director Nanette Bowler. Thank you.
Thank you, Commissioner Calabria, and thank you, Commissioners Miles and Stallings, for being here today. As Commissioner Calabria indicated, the kickoff for Neighborhood Networks was actually on September 15th. And what was so exciting at that kickoff is we had all the school partners there, the principals, and our staff there. And we first had a meeting with the principals to see if we could have buy-in. Well, to say the least, it was more than buy-in. I mean, enthusiastically, they were like, can we start this tomorrow? So that was the send-off that we got when we initially started this. So Health and Human Services and the Wake County Public School System care deeply about the safety, health, and well-being of our children and families in Wake County. So it's exciting to see Health and Human Services and the school system working together to bring this innovative programming to this county. We are piloting in Neighborhood Networks at 5 elementary schools: Adams Elementary, Forest Pines Elementary, Forestville Road Elementary, North Ridge, and here at Southeast Raleigh Elementary. Each of these schools has a Health and Human Services Neighborhood Network social worker who provides one-on-one support for families who are struggling with one or more of life's challenges. And I'd just like to briefly recognize we have Sheila Donaldson here, who is the division director, and then our Neighborhood Network social workers, if you could stand up real quick. So thank you. So while the school continues to help the student with their academics, our social workers, as Commissioner Calabria stated, provide support to the family and help connect them to resources and services that they need. But I want to explain something here. Simple referrals is not sufficient. We need to get to what is bringing them in the door in the first place. What are the social determinants of health needs that need to be met? Is it childcare? Is it work? Is it transportation? And the other thing that we're doing is we're not only collaborating with the school, but we're going to be looking at what other business partners, faith-based organizations, nonprofits can come to the table to work with the family as they develop a plan to address their needs. We are focusing on elementary schools because we really want to reach children and their families early on when they're first experiencing difficulties before they get to the middle school level and the high school level, and work to empower. That's the key here. It's not about us helping. It's about working together with the family to empower them and assist in preventing problems down the road. So this type of investment is really what prevention is all about. I've seen how Neighborhood Networks has worked in the communities and a very real difference this program makes to the children and families we serve. I've seen families as I've worked through this program in other jurisdictions, and now here, who desire to support their children and have been very frustrated because they were not being successful at finding what they needed in a sometimes complex social service system, and have a total different experience once they have neighborhood network social worker come in and first seek to understand. This isn't about telling them what to do. It's about seeking to understand their situation and then working with them to navigate through it. So once they're able to get their basic needs, this is a total game changer here. They then can focus on their children and other priorities in their family and become more successful in the schools and setting new goals for improving their lives. So I truly this has been it's a love fest. I can't even tell you. We meet quarterly, and the discussions that go back and forth, and it's amazing. It's not about your system, our system. It's very clear in those meetings that these families are the center and focus of the work. So I want to thank the public school system for the partnership and to see our pilot already making differences in the life of the families that we're serving. So thank you.
Good morning, everyone. Oh, wow, I'm nervous. So I'm going to be reading. Bear with me. First, thank you so much to our commissioners, to our school board, to our wonderful staff of this beautiful building. Thanks, y'all. But I'm going to get right into it. My name is Juanita Velasquez, and I am a proud assistant principal at North Garner Middle School here in Wake County. Thank you all for joining us today as we come together to celebrate this remarkable partnership between Wake County Public Schools, 4-H, and Alliance Behavioral Health. Through our collaborative efforts, we have made a profound difference in the lives of families and youth facing crisis. At the core of our school's partnership lies SET, the Student Engagement Team, a beacon of hope and support for those in need. Through SET, a program specifically designed to tackle post-pandemic challenges and re-engage our students and families by assisting them with their mental health well-being and needs, we have witnessed incredible transformations, stories of resilience, and countless lives touched by compassion and dedication. As this year's 4-H theme eloquently states, we are rooted in resilience. I can recall a beautiful example of such a moment since I joined North Garner back in January that truly exemplifies the impact of SET. During one of my principal-student discussions with a young man who had faced some challenges in class, he actually surprised me by requesting to see his SET provider. And this was an attempt to avoid consequences, but rather a plea for support, understanding, and guidance. This simple request speaks volumes about the trust and connection fostered through the SET program. Through SET, families and students find a lifeline in times of crisis, whether it's accessing mental health support through Alliance or receiving essential resources and guidance. SET stands as a pillar of support, helping families navigate challenges and empowering youth to thrive. Today, as we are here surrounded by like-minded individuals who share our vision, let us celebrate not just a partnership, but a commitment to compassion and community. Together, we are not merely changing lives, we are shaping futures. On this occasion, I'm honored to express my heartfelt gratitude to everyone who's contributed to the success of SET. Your dedication and support are truly making a difference. Let us continue to work hand in hand, spreading hope, fostering the betterment of our community, and building brighter tomorrows for all. Thank you.
Good morning. Good morning. Oh my, I'm so excited to be here with you today. So I'm Toshiba Rice, and I'm proudly represent District 4 of the Wake County Public School Board of Education, which includes this school in Southeast Raleigh. I'd really like to extend an honor to my school board chair, Mr. Chris Haggerty. Thank you. I'd also like to thank the principal, Lamar Hill, and assistant principal, Crystal Brown, and all the staff and students of this wonderful school and their hospitality today. So thank you for that. It is an honor to be with you all this morning to share just a few words that express my gratitude and enthusiasm for these two pilot programs, neighborhood networks and student engagement teams. Both are true collaborations between our hardworking school social workers and school counselors of our Wake County partners. School staff identify students and families who would most benefit from one of the programs, then connect with the appropriate county liaison. As you've seen and you've heard, these pilot programs already have made a real difference in the lives of the dozens of students and families. The needs in Wake County are great, particularly following the pandemic. It is also important to remember that every family situation is unique, and many require comprehensive and individualized services to help them overcome the challenges they face. Neighborhood networks and student engagement teams provide just this kind of intensive support, helping families with everything from housing to job security to mental health services. We know that students who have a stable home life are much more likely to succeed and in school and in beyond. That's why supporting families with their physical, financial, and mental health needs are also, while also strengthening the connections between school and home, are essential if we are to meet the ambitious goals set forth in our district strategic plan. Specifically, this plan compels us to eliminate disparities in student outcomes based on socioeconomic status, race, and other factors. Programs like these have the potential to help us reach that goal by making a significant and lasting impact on the lives of students and families who are facing serious challenges. Again, I am grateful for the innovative and energetic partnership with Wake County, and I am encouraged by the early success of these two programs. And I cannot wait to see great things we can accomplish together. Thank you so much.
Well, as you can tell from our speakers, we are really enthusiastic about these programs. And in listening to the stories and the descriptions from our folks, I'm reminded how many amazing people are working together, including so many of the people in this room, to make this happen. And in fact, I was joking with Ms. Bowler earlier that when in 2021, when I came to you with questions about how we could better integrate Wake County Human Services into our schools and all of that, it was like you just had this file folder in your head that you just opened up and said, okay, well, we can do this, and this is how we would structure it. And we just have so many amazing and wonderful and talented people. So we've got two programs here, but I think the mission is the same. Support our children and our families as best we can by taking a more comprehensive approach. Again, by putting the whole child back together. We really emphasize the connection here in both of these programs between the hardships that families face at home and what happens at school. We know that students and families are dealing with affordable housing challenges or difficulties paying medical bills that greatly impact how children grow and how children learn. Research shows that when caregivers are experiencing stress or difficulty meeting basic needs, those struggles show up in children's behavior and in their school preparedness. We also know, because we've just recently gone through the pandemic, that what we found through the pandemic is that through federal supports and state supports and local support, we expanded programs like food security, stimulus funds, eviction moratoria that help families stay in place. And although scholars will be debating for the rest of our lives about the impacts of that and what caused what, we did see lower instances of CPS cases. Of course, the end of those programs has destabilized so many of our families. And so this is really timely because we are stepping in at a time when we are more aware of the challenges our students face than ever before. These two programs are currently being funded by ARPA dollars, the American Rescue Plan Act, and will be through December of 2026. We are going to continue to evaluate how we can best move forward. And ultimately, if it goes well, I will say that my personal hope is that this becomes the new standard of care for how we treat our students. We need to acknowledge that schools are centers of community, and we have got to have the entire community embrace our children. That's what these two programs are about. So before we open up to questions, I want to just say a few thank yous, and then we'll have everybody up here to answer questions. First, I want to thank Nanette Bowler for really championing our Neighborhood Networks program. I want to thank Catherine Williams, who's here, who's the director of Wake County Cooperative Extension, and who, with her amazing team of folks at 4-H Youth Development and elsewhere, has really done a great job championing our SET program here. I want to thank Alliance Health, which has been a tremendous partner in providing behavioral and mental health care to our children and to our families. I want to, of course, thank all of our partners at Wake County Public Schools. We know that y'all are doing the hard work, and we are just so glad to partner with you on this and so many other things. And then, of course, lastly, I want to thank our educators, our teachers, our staff, social workers, psychologists, counselors, so many of the people in this room who are doing very difficult work, who are constantly doing more with less, but are making a tremendous impact in the lives of our children and our families and ultimately our community. And for that, I know we are very, very grateful. So with that, I'd love to have our speakers and any elected officials we have come on up, if only to stand up here and show our support for this program. We'll open up to questions in just a second. Just a programming note, I believe our communications staff has promulgated through the press release and some other things as well. Y'all come up, don't be shy. Has promulgated some information, including an interview with one of the parents whose family and whose child has gone through this program. Of course, we have anonymized it because we want to make sure that we keep that information confidential, but you have access to that as well online. Dara, did I get that right? Okay, very good. So, questions? Yes, please. Yeah, it's a great question. The answer is yes, but I'm going to call on Nanette Bowler to say a little bit more about that. We were just talking about that right before, and others may have thoughts on that as well.
So collectively, it's not just Wake County, it's also schools. We're developing what would be success measurements, and more than outputs, we're looking at what are the outcomes. So far in the output category, we've had 73 families referred and 35 are being served. What we're looking at right now, collectively and collaboratively with the school, is what does success look like for these families? On the academic side, it's improved grades. It's decrease in absenteeism. What we're also looking at, though, is we've developed a tool that we're using that takes all the social determinants of health, so anything from transportation, childcare, work, education. And we've got a tool that then says when they first come in, they get evaluated for each of those social determinants of health. And it goes from crisis to are they safe and stable to are they thriving. And there's questions affiliated with each of those categories. So the goal then is we take an assessment right in the beginning to see what are the immediate needs that need to be addressed. And then at intervals, we're going to be evaluating the family. And the goal then would at least to be to get the families to where they are thriving ideally, but at least safe and stable in those categories. Thank you.
That's great. Thank you. Anybody else? No? Okay. Okay. Great. Did that answer your question? Okay, good. Anybody else? the question is, can we elaborate on some of the other benefits that we're seeing from these programs?
Well,
How much time you got?
how much time do you have? I know we had a recent case. You know what, Albert? I'm going to have you stand up. And I believe we just recently had a family, and their huge barrier was language. So if you could speak to that, and then there was one other family, right?
Okay.
I know I put you on the spot, but you guys are the ones in the know here.
Be ye also ready. I am Albert McMillan. I am the Neighborhood Network Supervisor, and I have an awesome team of social workers who are in the schools. The current impact that we have had on families who are participating in this program is that we have a large population of non-English speaking families who have had tremendous barriers with getting support and resources available to them because of language barriers. Our social workers, in partnership with Wake County Health and Human Services and our interpretation team, has been able to provide interpreters to be a part of all of these meetings so that the needs of the families are properly communicated and resources are identified to assist these families. We also have had recent success with one of our families from Northridge Elementary, who within about 26 days from the time of their referral until the time of their success, went from a place of being homeless and unemployed and underserved to, in 26 days, having that stable housing provided for them through the help of our social worker. We have had other success stories as such. Our program provides a intense, intimate relationship between the social worker and the family to provide those resources and to give them that support team that they once was absent of. So from the time of our referral to the time of our first visit, to the assessment of needs, to the establishment of what the crisis is, our social workers are adamant advocates and supporters to get them to the place of crisis, those presenting problems, to a place of where they are thriving individually for their family, which includes stable housing, adequate employment, food and nutrition programs, setting up and establishing medical and behavioral and therapy services for our families. So thank you.
That was good. I'm going to have you give all my speeches from now on. And just more broadly, I mean, think about the panoply of challenges our students are facing. All of our families. I mean, we know that housing and bullying and substance use and mental health are all top of mind issues that we talk about all the time. And we also know that when adequate supports are brought in to address those issues, as well as food security and any number of issues, that we see test scores increase, grades improve, absenteeism decrease, behavioral health issues decline, disciplinary issues decrease, and ultimately we know that healthy children turn into healthy adults. And so it's so critical that we are looking at the bigger picture, and these programs for the first time are really enabling us to do it in a way that we just haven't before. So I think we had a question over here. Yes, please. Absolutely. Yeah, please.
One of the things that I'll share, outside of the fact of the great collaborations that's happening, and I have to share with my colleagues, Commissioner Waters and I are actually having a listening session in this very community that you're speaking of on Thursday to continue to expand our ear to hear what does the community say that their disparities are. What are they saying that they need support with eliminating barriers that are educational and economic progression. So to answer that, yes, we are extending this to communities and populations. It'll be Thursday at 6:15 right here in the area that you just spoke about, right here at the Y next door, from 6:15 until 8. We'll actually be having that community engagement piece and that conversation so that we do hear specifically from the families that they say say that need the support so that the great people that have shared today can continue to do this work and to do it effectively in a partnership collaborative.
And just to add to that, thank God we live in Wake County.
Yes.
Because we really do have a county commission as a local government that cares about our people and was willing to work with the school system to provide these kinds of services above and beyond what's mandated by the state. One of the things that Ms. Rice and I and our other school board members have been working on this year that we're very proud of is really extending our community engagement.
Yes.
Being able to go out, listen to the community, find out what we're doing well, what we're not doing well. And when I say the community, I don't mean just people coming to Cary and speaking at our meetings. We really want to be out in the community, bringing our message and listening to all people, regardless of language, Spanish speakers, French speakers. We have maybe 16 different possible translation services that are offered out there, and bringing everyone together in our community is just very important and very key. But again, we couldn't do that work without the folks you see up here. So special thanks to them.
Thank you very much. There we go. Okay, our comms folks are giving me the one more question sign. Do we have one more question? Going once, going twice. Yeah, please.
Brian Segovia from Unity Reporters. Could you tell us a little bit about the initiation and the creation of these programs? We know that after the COVID-19 pandemic, the student success rate for minority students really dropped off, if not for all students, but specifically really impacting minority students. Did that at all play any role in the creation of the program? Was that one of the leading reasons for the creation of these programs?
I think a lot of folks will have lots of different perspectives that they can bring to this question, so I'll turn it over to whoever might want to say more. I will tell you that we have been looking for years. I've served on the county commission for a decade, and as long as I can remember, we've been looking to try to find better ways to integrate our different services, because there are things that the county does well, because that's core business for us. There are things that the school system does well, because that's core business for them. And so we have always been searching for opportunities for collaboration. It was not always the case. If you look back more than a decade ago, frankly, the school system and the county commission did not get along in the way that they do now. And so having strong relationships across elected officials, across institutions, creates such fertile ground for us to be able to do tremendous things. We are all on the same page when it comes to helping our students. And so the point I would emphasize is that we have been searching for these kinds of opportunities to break down silos, to better deliver services to our population, because we know that we have so many amazing programs in Wake County through the schools and through county government. But we know we could serve so many more people if we did a better job of getting those services connected to the right people at the right places at the right time. So that's the background. And then, of course, I mentioned the conversation that Ms. Bowler and I had in 2021. Mr. Mahoney's here from our Human Services Department, and I remember a very dynamic presentation you gave in November of 2021. It was one of the last meetings I had during my tour of duty as chair. And so we really came together and brainstormed very quickly. I know Nanette and maybe others can talk a little bit about the genesis of these programs, but it was sort of a perfect storm of a desire to do these kinds of programs, plus a peak in the need for those programs with the isolation and all of the challenges that came with COVID-19. But I'd defer to others to speak about that as well.
So just a little bit, and I'm going to turn to my colleagues and that includes you, Principal Velasquez. We all know that the pandemic had an incredible impact on our children, especially our youngest children, right? And the ability to teach strong early literacy skills for our youngest learners was really, really challenged. And I don't know what you saw when your elementary school kids were coming up after those years into those schools, but we know that K-3 literacy is essential. We know coming in and trying to add additional care and support for those children that were in K-3 during the pandemic now through the rest of elementary and into middle is just so important. And then we know that all of us in the community were affected through the pandemic in terms of our mental health and the need for support. And I know, Ms. Rice, you've done a lot of work with youth mental health and wellness. Would you like to comment?
Right. I wanted to say integrative care doesn't have a zip code on it. Integrative care is for everybody. And so it's not just an exacerbation of the pandemic and what it did, but these services were needed, as our colleagues stated, even prior to. We just had to figure out, how do we work collaboratively together to make it happen? And so we've seen great things that Health and Human Services has done with sharing and integrating the mental health support with Alliance. And I've sat on numerous of these boards, and I do trainings and all those great things around mental health, and as a profession in case management and training and consulting around these very things. But I just wanted to share with everybody that integrative health is important for all, and it makes our county better, it makes our county healthier, and it helps us focus on the well-being of everyone, regardless of what zip code we're in.
That's right. Excellent. Just real quick.
Please, yeah.
All right. My heart in this. I think what COVID did was just validate what we already knew. It really did. And I'm an attorney by trade, and I represented for years children and families seeking services. And what I often found when I would go and help advocate for those families is that they would show up. Did they really have an opportunity to be heard? Were they really being listened to? And part of what I saw was the services were defining the needs instead of the needs defining the services. So what I'm really excited about, and I've seen this in all other jurisdictions that I've practiced using this model, where you have a mom who's been trying to get Medicaid, coming to an event at the school where they had the food pantry. And then we had, and we're also going to infuse this here, our economic social service eligibility workers will be present at the school also for events so that they can have easy access to food and nutrition, to Medicaid, right, to TANF. And when that mom walked in and had been trying to get Medicaid, not through the system, but on her own, she ran home to get the paperwork because she was having kidney problems. And they were worsening, and she had 2 little ones that she might not be around to take care of. She ran home and got the paperwork. We immediately got her eligible, and she got the treatment that she needed. So this is the type of things. We could go on and on. But really what I see this is a recognition, number one, there's a lot put on our schools that are beyond the academics, that they're having to hold the ball with. And we can't have that continue if we really want to have fruitful outcomes for our families. So this is really a meaningful collaboration that we all know that if we work together, which we are, we're going to make a difference. Thank you.
So, hey again. I can only speak from a school perspective, but what I can say is that we have definitely seen an increased need across the board. North Garner has this unique mix where ethnically speaking, culturally speaking, our school is about a third, and a third across different ethnicities. What that means is we can see all ethnic groups need this assistance. All socioeconomic backgrounds need this assistance. As it was stated earlier, yes, our kids who were in kindergarten through 3rd grade at the start of the pandemic are now in middle school. And oh my goodness, one of the things that we are doing as a school is we are inviting the community in because we need help. It's a partnership. It is one of those things where education takes passion and dedication, just like any job of any of the people in this room. But we are working towards helping make sure that our kids all have the best possible outcomes, y'all. And it's not easy work. It's not overnight work that's going to magically happen in the morning and we're going to be great. It is one of those marathon races, and I am just glad that we're all in this together because, yes, we've seen it across the board, but there's always hope, y'all.
Very good.
Whew. Well, I can tell you, I am so proud to be in Wake County, as Mr. Haggerty, the school board chair, highlighted. We have so many amazing, passionate, smart, capable people doing wonderful work. And so I'm so proud and so heartened just to hear a little bit more about that today. I also want to thank everybody in the media for coming. And this is so important because, as I alluded to earlier, we have so many aids and programs and forms of assistance, and we are working so very hard to connect folks who need that assistance to the resources that they need to succeed. So thank you so much for helping us spread the word. Please continue to do so in the future. That concludes our press conference. I'm sure we'll all be hanging around afterward if you have any further questions. But thank you again for coming.